According to the World Health Organization, dental cavities, gum disease are very common. Let me just quickly give you a few statistics. Now, between 15 and 20% of adults aged 35 to 44 have severe gum disease. Are you in that bracket? Welcome and good evening. This is Health Check on Hope TV, where you look and live. It's Kerry Kagiri. I'm sorry, I'm all masked up because I have a few sneezes up and pale nastaki kuputa our guests in any form of trouble. And I think we should adopt this. If you're feeling unwell, don't expose anyone around you. Go ahead and wear your mask. It's okay. You protect all those you love. Today's episode is one I'm very passionate about because as a 16-year-old, when asked, what do you want to become? I said, I want to be a dentist. And then we went to the reality. Unapata, how many marks? Wapi na wapi? And I was told, girl, go for the arts. But I hear I can still pursue it. Let me welcome our guest in studio. We'll start with a lady guest. Thank you so much for joining us. She is the founder of Smile Changes Foundation, Ruth Mungai. Karibu sana.
Thank you so much, Kerry.
Please let our guests know what exactly you do at Smile Changes.
Thank you so much, Kerry. I really appreciate to be here today. Let me say I'm a dental clinician.
Yes.
I work in Kenyatta University in the staff and student dental clinic. I also run a clinic in Kahawa Wendani. It's called Baraka Smiles Dental Clinic. And above all, I run a foundation, which is called Smile Changes Foundation. In this foundation, we do oral health awareness. We go to school, we teach children how to do proper hand wash, proper oral hygiene. We implement clubs, they are called Smiles Clubs, and we have champions who teach others how to do proper oral hygiene.
Wow.
And apart from that, we also do dental screening. Then we send a report to a parent or a guardian, and we tell them how their children are doing. And also we lobby for toothbrushes and toothpaste, which we distribute to the needy children in the society. And right now, the schools are not operating, so we are doing it in children's homes.
That's so cool.
Yes.
And she has a lot of equipment. We're going to be learning so much. But to work hand in hand with her is our dental surgeon who has joined us, Dr. Elvis Mutai. Karibu sana.
Asante.
Yes, you do run a cool spot called the Smile Studio.
Yes, we do.
And why did you decide on dentistry, though? I'm just really curious.
I always knew I wanted to become a doctor.
Uh-huh.
I think that's, as you said, back then when we were growing up, I used to see, there used to be an uncle of mine who used to visit a lot. And I used to really aspire to that. And then, of course, Ben Carson happened.
Oh, yeah. Big the picture and all
so,
this.
Exactly. So he happened then. I mean, I always fancied it. And then I had mentors in the field that just guided me through until ended up there.
Okay.
Yes.
So what do you practice?
I practice at a hair center,
Okay.
third floor,
Yes.
clinical Smile Studio, as you said.
Good.
Yeah, been there now. This is the 6th year running.
Yeah.
Yeah.
Let's talk about the few things we'll be highlighting today. The first one, I'm sure everyone will be texting on 22232 is bad breath. Oh my. Halitosis.
Yes.
We'll be talking about that. And there's also bad breath that's not halitosis. Yani just someone who has bad hygiene, right? Because
It's generally halitosis.
Okay, generally.
That's the term. Yeah.
Okay. Cavities. We'll also be talking about cavities and now gum disease. Can we start with what causes bad breath and how can it be treated? We'll start with you, Dr. Elvis.
Bad breath has various sources. Of course, if you pack in the food and then you're not, basically what you said earlier, poor hygiene, that is just the genesis of halitosis. And then you have that has, staying in the crevices and then just, saliva is has digestive enzymes in there. So they'll start digesting the food in your mouth and then they'll have byproducts and then the bacteria will latch on to the digested elements and then produce waste, and that is what will produce the smell. Now, should you leave that for longer and there's more and more of it coming in, then the bad smell just keeps getting worse and worse with time. That's one area and the most common one, which is easily treatable, whereby you can just clean it and then the patient will be just fine. The next one would be disease. If you have disease and then, that is particularly to do with your throat. So if you have tonsillitis, for example, or you have a sore throat that has been there and lingering for a long time, and then that area gets infected, that infection produces a bad smell, and then that is the next source of halitosis. So that necessarily doesn't have to do with the cleaning, but more of treatment and the medical team. The third, and sometimes actually it's on the more common side, is psychological, whereby you claim as the patient that you have the bad breath, but you do. I mean, no one else can perceive it.
Yeah.
These are the more difficult to treat people because they'll not believe it when you tell them you've cleaned and everything now is okay.
Yeah.
So they tend to be coming more and more frequent, and they'll be visiting clinic after clinic, seeking that the fresh breath. And they'll always have a gum. They'll always be brushing. They'll be conscious. Now with the introduction of masks, I'm sure more are safer because they can hide behind it, as opposed to having the treatment done.
Yeah.
Yes. So those are the three common sources of the bad breath.
Madam Ruth, is there anything you've experienced with, first of all, children? Because you're always in the presence of children. Still in regards to bad breath.
Maybe I cannot also add something.
Sure.
We have food that cause also bad breath. Like there are people who, like when you eat garlic, definitely
Yes.
you get the bad breath. And also we have habits like smokers. You get them having those bad habits. And also we have some other diseases, like someone has tonsils or some GIT infection. You get people having that bad breath.
That's a gastrointestinal.
Yes.
Okay, yeah. I've
Yes.
been doing this job, man. Dr. Carey in the building.
Yes, but most what I can say with children, what they suffer more is what Dr. have said,
Yes.
the poor oral hygiene.
Yes.
Yeah, most of them you find they are not doing it the right way. Yes, you know, most of the people do the brushing, but I insist saying it's not just about brushing, but the proper brushing. Yeah, so you'll find most of the children don't do it the right way, or they do it in a hurry. So at the end of the day, they develop these diseases which cause the bad breath.
So before you judge someone, at least now you have a general perspective that there are underlying issues that could be causing the bad breath of the person you're with. The last week, but when we had an ENT and we're talking about bad breath, it just came up. And I was like, you tell someone, I'm bored, let's go brush. And then maybe, you'll eliminate some of the issues. But just coming to that, let's talk about dental cavities. I'll start with you. Can I call you Madam Ruth?
Yes,
because
okay.
you're like a madam, Madam Ruth,
Yes.
what are some of the issues causing dental cavities? And what are dental cavities for someone who's like, what are we talking about?
Dental cavities, these are permanent holes that you will see in a tooth that occurs when someone feeds on food and they don't do the proper tooth brushing. So these particles tend to combine with the saliva and they form a solution or some acid that now attacks the tooth and it forms a permanent dent, which is called a cavity or a decay or caries.
But I'm just wondering, this is so powerful because our teeth are like 2 times stronger than bones. How powerful is this enzyme that can actually cause something to eat into the tooth?
Yeah, you see a tooth structure has several components.
Okay.
We have the harder one, which is the enamel. Then we have another one inside, which is dentin. Then now we go deeper to the cavity. Now we go to the root or the root chamber. Now, when the cavity it attacks slowly. It starts from the enamel. Now, in the enamel, someone will not feel it. You will not have pain. But when you come to us, we'll look at it and we'll see some white spots, which develops to be black spots. And if it goes untreated, it develops now to the hole. And also, if it goes untreated, it develops now to have issues in the nerves. The cavities goes deeper to the nerves, and that's where someone have pain.
Okay.
Yeah.
I'm wondering if our director did get the images of what it actually looks like.
Yes.
If we could have that as we continue with Daktari, just to comment, and then we'll be back to you.
Yes.
Dental cavities.
Yeah.
What do these look like?
I mean, it depends. As she said, it's a very gradual process, and that gradual process has different appearances. So the initial one, as she correctly put it, is a white spot. Then that picks up the stain because you see that is now soft enamel. It's no longer that 2 times the hardness that you mentioned compared to the bone, because the softening has happened because of the acid production by the bacteria, which is consuming whatever you've eaten. So you have that over time, and then now that picks up stains from food, and then that turns color to whatever you're commonly eating and composing your diet. The color that will be picked up because it's absorbing. But then if it's now turning into a disease process because now the body is reacting back, when it's getting down to the dentin, as she correctly put it, in that second level, then you find that the body tends to try and protect itself because that's where the nerves are. So then that turns to a dark color. When it's progressing further and further, then you find the weakening can cave in. When you now just say you're eating something as soft as even rice or ugali, then suddenly you feel like, oh, that's no longer ugali, but there's something more stony in there. So that's a part of your tooth that is caving in. And that's when you have the hole. Now that hole is going to be different in terms of how big the cavity has been forming over time. It could be a huge thing or a small thing. And I think that's the farthest you can perceive as a layman or just yourself checking in the mouth, in the mirror. Beyond that, now what we will see is different because now we will see the different layers where it's enamel, which is bright white, and the dentin, which is cream. And then if you get down all the way to where your nerves are, as you put it, then that appears red. So that is what we will see in the mouth. Then there'll be an element of the darkness where the body is reacting, trying to protect itself, that we will see also.
Absolutely. This is serious because between 60 and 90% of school children have at least one dental cavity with them. Now let's go to gum disease because we want to explain them all and then now we can get deeper.
Yeah.
What is gum disease and what does that look like?
Okay, gum disease is the gum is the structure that supports the tooth. So these bacteria, they can either attack the tooth or attack the gum. So when they attack the gum, it also has stages. Now in the early stages, this is what we call gingivitis. But when it advances, we call this periodontitis. Now this gum disease, it's when someone now start getting the redness or sensitivity. And also, it can also manifest in the halitosis. So in this stage, when someone comes to us, sometimes you can see the gums bleeding, or just when you're brushing them and they are bleeding. So this is a symptom of a gum disease. And sometimes in severe cases, you'll get this having abscess and swelling. Yeah, but all these are caused because of the gum disease mostly is caused by poor oral hygiene.
That's kind of true. I had the similar experience where my gums were red after doing the yearly cleaning. Then they just stopped swelling and everything was back to normal. So how important is it, Dr. for someone to come into the Smile Studio and have a cleanup at least once a year?
The importance, as she put it, is, and you've also mentioned it, is just literally to sustain your teeth. Because you find the gums is covering, basically the disease is attacking the supporting structure of the tooth. That being the bone, which is the foundation down there. The bone is now being attached to the tooth by a ligament. That is what she is calling the periodontitis, which is basically the periodontal ligament attaching the tooth to the bone, and then now the gum covering it. So all those three are being attacked by a disease process. Now, if you want to lose your tooth or your teeth, the quickest way to do it is just let it attack continuously with no attention whatsoever. You know, ignoring that bleeding gum, ignoring that sensitivity, and that sensitivity is not by an obvious cavity you can see. Ignore that shaking tooth. In no time, you will be showing up all the abscess that is stuck in the pus that is discharging. Ignore that. Then the time you're coming to the clinic, it's too late for us to do anything. So the importance is if you want to keep your teeth, because teeth are meant to last a lifetime. If you want to keep your teeth in your mouth to chew well, then it is important to come in for that checkup, that yearly clean. But then the cleaning varies from person to person. There are people we want to see 3 times a year. There are people we want to see once a year. There are people we want to see even up to 4 or 5 times a year.
Okay, I didn't know that. Awesome. So you need to get yourself a dentist. Can I shout out my dentist? Like, I'm not being loyal, but Dr. Hawa, thank you so much from Molars. Cheers. Let's do this. Is gum disease reversible?
Yes, it is.
Completely?
Completely.
Okay.
Yeah.
And as you respond to that, what are these warning signs that people get? And I think we've mentioned them here and there, but what are some of the warning signs for our viewer that they'll get to know there's something wrong with my dental health? Yeah, or gum,
Well, okay, let's start with the gum. So sensitivity.
Yes.
Most of the people will complain about sensitivity when somebody takes hot, when somebody takes cold, something acidic. You hear people say, I take something and I cannot do it because I'm getting so much sensitive. So that's one major sign. The other one, as I said, is the bleeding gums. When you go and start brushing and you find your gums bleeding, that's also another sign.
So gums should never bleed while brushing?
No.
Okay.
And I also say, I don't know, Dr. will say something about this. You see, when you eat and you find yourself like you eating meat and it's getting in between the teeth, already that is an advanced disease because it has entered between, the gum has entered, the disease has entered between the teeth inside between the gum, between the teeth. So it forms something we call pocket. So when you eat something, it gets inside there, and people have, every time they eat, they use a toothpick because something is clinging inside or in between the teeth. So that's also a sign. And the other one, some people also have pain. Yeah. So those are also, those are major
those people
signs.
with beautiful teeth, like with the huge space. Oh, that's a whole different
No.
those are people with I was gonna say olekiapi, but I will.
That's
let's-
called a diastema. But what I mean is, I wish we have a picture we can see what I mean. But
Sure.
in between, I can show it with my hand. In between the two teeth, it gets deeper.
Yes.
A bit deeper. So that's a pocket.
Okay.
Where food starts to settle.
Okay.
Yeah.
So I like that you showed the hand because now everyone can see the ring. Sorry, gentlemen. Sorry. There's someone who had matumaini.
Calling in.
Don't call in about that. Dr. do you want to comment on the same?
I mean, she's staged it nicely.
Yeah.
Because initially you will have actually sometimes even without the sensitivity, the very initial sign will be change of color of your teeth. Some people will complain that my teeth used to be whiter.
Yeah.
They no longer are, and there's no bleeding, there's no symptom. Then that's the beginning of the data accumulation. If you ignore that, then it gets that stage where she's talking about the redness and the bleeding. And then you ignore that, then you start finding now you have to use a toothpick. You ignore that, then the tooth starts having pain when you bite down.
Oh.
And then you ignore that, that starts being a loose tooth. You ignore that, then that starts being a loose tooth with past discharge, and you can even pull it out yourself effortlessly.
Oh
Sure.
my.
And then if you ignore that even further, then now it just starts becoming a whole mouth situation.
Yeah.
So you find that it will sometimes start with in the molars and then spread across.
Yeah.
So you can actually lose a whole set of 32 in a year.
What?
And that has happened. And sometimes when they walk in at that stage, we really can't, what you're saying, reversible.
Yeah.
It's beyond reversible.
Beyond there.
And I think you've answered it, but I'll just ask, when should one see a dentist?
Maybe, Doctor, just to add
Yeah,
something
sure,
on
please,
that.
go ahead.
There's what we call plaque. Is also a
Yes.
sign of the gum issue.
Uh-huh.
So this one manifests as, you'll see like another tooth is growing inside. So it starts as tartar, then plaque, then calculus. It's something that develops, especially inside the tooth.
Tata. Not many people understand what Tata is. Can you try and explain? And we're
This-
still trying to get those images, director, so we'll be using the images shortly.
Yes, this is a substance that when these bacteria they settle in the mouth and stay for long, they start forming, as Dr. has put it, some stains start coming in the mouth. Then they are becoming black, then they are becoming like milkish. Something like another tooth is forming, something very hard that you cannot do away with your brush, unless now you come to the doctors and they will be able to do a professional cleaning. Yes, that's what you remove. And at times you can look at someone and you think they have a double teeth.
Yeah.
So that is what we call calculus. Yeah.
So you need to be very careful. In terms of, this is something that can be managed by proper health through and through, proper cleaning through and through, right?
In very early stages.
In very early stages.
As
Okay.
it goes on, we'll have to do a dental professional cleaning.
Okay. To that, Daktari, here's a question. When do we need to come and see you?
I mean, don't wait for pain.
Sure.
Yeah, and then your dentist will recommend the regular check. Consider it like a wellness check.
Yes.
So you walk into your dentist because if you go in because of pain, then sometimes it might be too late for whatever procedure, or it will be a longer, tedious, and more painful experience. Dental experience can actually be good. Because if you come in with that regularity, if you bring in your kids as soon as they have their first tooth or even the gum pads without teeth, that's the soonest you should see your dentist. We advise on hygiene, we pick up growth issues, and then we can continue monitoring that child throughout growth and make sure that the set of 32 come in well, because there are certain habits that will form in between. So all the way from kids, the minute you see a tooth in the mouth, bring them to the dentist.
Yes.
Let us just walk you through what to do in terms of hygiene.
Absolutely.
And then if you're getting to the infants now, they have their set of 20. Again, let's do that annual check. Let's reduce the chances of them getting cavities, and then let's have them get used to coming to the dentist, because that habit is good, and we will monitor their oral hygiene and give them good practice at home, as opposed to that, you know, when they go to schools, they might not have that individualized attention for every one of the children.
Yeah.
And some might, you know, go under the radar without being, so with that close supervision by the dentist and the parent, we can tailor make whatever they need. We can also advise on things to do so they avoid, like, you know, nowadays there's a lot of borehole water use, so people are showing up with more brown teeth.
Yeah.
So we can, you know, advise what kind of water to use for them so that they don't end up having trouble later and then having esteem issues because of a bad smile that is brown and whatnot. That's a whole other issue that is now becoming.
And thank you for bringing it up. I'm sure that will come up, like
Yeah.
what happens with people and the different colors of their teeth. But can we now link oral health and our general well-being? We start with you, Madam Ruth. What are some of the things that our oral health can benefit our general well-being?
I can start with, you see, like when someone is suffering from diabetes and they tend to have these gum issues. So if they have a wound, they will not heal very fast.
Oh, yes.
Because of the diabetic issue. And also research say that this gum issue hinders insulin from being absorbed. So this diabetes cannot be prevented. Yeah. So the other issue, when I was doing my study, I learned is there's some toxins that can come out from this tartar, from this calculus, and when a pregnant mother is carrying a baby, they can have a preterm. They can come out before because the toxins can go in the placenta. Yeah.
Wow.
Yeah. Then
Just some of them.
yeah. The other one is the research connect with it with cardiac arrest because they say some of those particles can go to the arteries and block them, and you can have a cardiac arrest.
Wow.
Yeah.
That's huge. Dr. Do you have any thing else to add on the same?
Yeah, I mean, I'd say the cardiac issue as well is just that, you know, that sense of bleeding gums is a constant state of inflammation. Inflammation is an immune reaction. So you don't want your immune system constantly active. And if that continuous inflammation is present, then the heart issues that she's mentioned, the preterm situation that has happened, loss of teeth, and then you find that now, you know, that ends up even becoming a mental problem for the patient, because that's a general well-being of someone. So psychological can be affected, and then it can end up being a psychiatric case just because, you know, someone is not very confident as well. Then you find that when you lose teeth because of gum disease and other like tooth decay and whatnot, the airway also tends to be affected because that constant inflammation again happens. And then if your jaw collapses because you are not having, I mean, you have lost your teeth, then that goes down to your airway as well. Chewing becomes a problem, nutrition ends up suffering, and then you suffer lack of nutrition, particular elements that you need to chew and whatnot. Yeah, that happens for you. Then we can also pick up other diseases that manifest orally. You know, and also the medication that people are taking sometimes can manifest orally.
Absolutely.
Yeah.
When someone has a toothache, it's like the whole day has been interrupted.
That's the thing, yeah.
Let's help our viewers this evening, to take care of their teeth. Can you both just show us how do we brush our teeth?
Okay.
Yeah. Because that with any of you. Whoever's ready.
I think she does it
Ladies
more.
first.
Let's talk
Okay,
about that.
fine.
Yeah.
So we can zoom into the gadget right now, and you guys can see we have teeth in studio.
Yes. So
Gadgets,
I have
my
this.
friend.
Yes, I have these products.
Fancy.
Kerry. I get them from Germany.
Okay.
These are electric toothbrushes.
Okay.
So
Fancy.
yes, there you go. So then
Maybe you can point it towards the camera.
Oh, yeah,
so we can
yeah.
have the short zoom. Okay,
so
that camera.
yes. This is an electric toothbrush. It's very good
Okay.
for brushing, and it's entertaining to the kids. They are very problematic
Yeah,
at times with
yeah.
the brushing. So the few parents who have used it, they have a very good testimony about it.
Okay.
Yeah.
Okay.
A few pieces remaining.
Okay.
So
No, you didn't.
So this is a tooth timer. I will talk about it because we say it's not just about tooth brushing, it's brushing the right way.
Okay.
So this tooth timer, it is to help a child. You fix it in the wall where you do the brushing. So when you put it, then you time it.
Okay.
This one is a 3 minutes timer.
Okay.
So you don't finish brushing
Until
before. Yes,
Okay.
because many
Like
are the time.
signs to the hourglass.
Yes,
so are
yes,
the brushing
yes.
minutes of our life.
It's very nice. They use it a lot in developing countries, so
Yeah.
we thought we start introducing it here, and it's doing so well to the kids.
Okay.
Because you realize, even you personal,
Yeah.
you can tell me today in the morning when
Yeah.
you started brushing, you are like, huh? And you are done,
Yeah.
and you went. But when you use this, it helps you to
Okay.
use the right time to
Okay,
brush.
sure.
So this is our mouth. So when we start brushing,
Yeah.
the most important thing is to make sure, I always use this why, when, and how. So why we are brushing, that's what we've tackled. When we should do it, at least we say at least 3 times, but
Okay.
2 times
Yeah.
before
Uh-huh.
before breakfast and after
Yeah.
dinner.
Okay.
You know, there's this song that we were taught in school.
Okay.
I wake up in the morning.
I wash my face, I brush my teeth, I take a cup of tea,
Yes.
and then I run to school.
So what were you taught there, Kerry?
I was told to wash my face, brush my teeth, and run to school. What?
Yes, so you are told to wash your face,
Yes.
to brush your teeth,
Yes.
then you take your tea,
Yeah.
then you take your bag,
Yeah.
and you go to school.
Yeah.
So that's what even today we are teaching our kids. So I think, Daktari, we need to do something in that curriculum.
Yes.
Because most of our children know you clean your face, then you to brush your teeth, then you take your breakfast, which is wrong.
Yeah.
So you take your breakfast
Oh, snap.
fast.
Oh, yeah, now I see it. I'm
Yes,
like,
now you
everything looked okay.
no, it's not okay because
But
yeah.
wait, there's this thing, I don't know, like taking your breakfast with your sleeping breath is really weird. Could we then just brush twice, like brush when you wake up, take breakfast and then brush when you're done, and then leave?
Maybe you can, or just gargle some water.
Oh, yes.
Probably that helps.
Okay.
Then now after breakfast,
Yeah.
that is key. After
Sure.
breakfast now, it's when you brush.
Sure.
So let's go to how we do it.
Yeah.
So this being our mouth,
Yeah.
so we always say we do our brush 45 degrees. Then we do it in a circular motion.
Okay.
Most of the people tend to do like this. And this will injure our gum.
Yeah.
So you brush it. This being our teeth,
Yeah.
you brush them very well in a circular motion,
nice.
so that we can be able to get inside the gum and be able to remove those particles that tend to hide. So we can start with the upper one. Slowly, we do it. Every tooth by itself. So when we are done that upper side, we can finish with the whole upper side. Then we go now to the eating services.
Yeah.
These are the eating services.
Yeah.
So we brush the eating services.
Guys, we're about to change your whole life. You're not
Yes.
ready for this. Thank you for watching. By the way, we are live on Facebook, so you can share this video right now to your friends. You can start a watch party so that everyone can get to see what's going on out here. Thank you for
Then
doing that.
after that, we go to the inside.
Uh-huh.
So this is a part that I've realized most of the people forget to do it. So the inside part, we're still doing the round way, the circular way. Then this part that most of the people forget, we make sure
Yeah.
it is well cleaned.
Okay.
Then we go to the downside,
Yeah.
we repeat the
The
same thing, just
Okay.
the same thing.
Okay,
Yeah.
awesome. That's just one way to brush our teeth. Doctor, us guys, we don't have this electric brush. How do we use the regular?
I mean,
But Mungu anaweza tuonesha pia. You never know. We have a guest who has some gadgets.
they've limited stock.
Limited stock. I know, right?
At least you know who's selling. Madam Ruth can supply. Well, we tend to say that if you don't have the efficiency when doing it with a manual brush,
Yeah.
then you'll transfer the inefficiencies onto your electric. What she correctly
Wow.
said is that 45
We should
degree.
tweet that. We need to tweet that, yeah.
Yeah, so what you should do that 45 degree angle, and I mean, don't go sitting there with a protractor and trying to measure your
Yeah.
45 degree angle.
Yeah.
So I mean, what I tell my patients is just point the bristles towards your gum. All right. So when you point your bristles towards your gum, and at least you have, I don't know if the camera can get that.
Yeah. Yeah.
Yeah, so now I need to work with the lens and my hand.
Yeah.
So if you point right this, yeah, there, okay. This is difficult than I thought. Huh? Yeah. Anyway, so there you go.
Yeah.
Can you see?
Yeah.
Yeah, so you point it towards your gum, and then now you do that circular motion.
Yes.
But then with this, you're not doing those long strokes, you know,
Yeah.
which most people do, because that will tend to miss a lot of the surfaces. So point it towards the gum, do your circular motion technique, and then massage. You see, I'm staying on the same set of 3,
Yeah.
and I'm doing like almost 5 strokes or something.
Yeah.
And then moving on to the next set, like that, right? So you always do an upward stroke at the end of the 5 as you go
Yeah,
around.
my mom says that. Hey, mom,
Yeah.
you're on point.
She knew what she was talking about. So
I
you do
know.
the same all around, and then the inner part as well, do the same, point it towards your gum, do the circular motion as you're going upwards like that. When you get to the top surface, don't do that. All right, that's not going to be very efficient. Stay there and try, and it's like you're picking dirt out of a dirty surface, right? So you stay there and just focus your brush on those particular teeth as you move on that way and go. And then when you get to the part which she says it correctly,
Yes.
all often forgotten, now it's a tooth at a time, circular motion upwards that way as you go. The same is repeated for the top, and you're done. So you find that if you're doing that correctly, you'll actually find 3 minutes is even less. You need a bit more just to get through. Don't forget your tongue.
Yes.
Yeah, so make sure you brush your tongue. Another source of bad breath.
Yes.
Brush your tongue. Rinse. If you can gargle some water, and then follow it up with a mouthwash,
Yeah.
facing upwards, so that you get to clean the places where your tonsils sit.
Yeah.
So your mouthwash can get there and, get the dirt out. Then you're done.
I want to say, everyone is watching this like, what have I been doing all my life? If you're feeling that way, don't worry, it's not too late. You're still safe. Text in your questions, because we're going to be coming back to get all your questions on 22232. You can also comment on Facebook. We are at Hope TV KE. Check us out, Hope TV Kenya, actually, on Facebook, but on Twitter it's Hope TV KE. As you do that, let's talk about flossing, and then we'll talk about mouthwash. We are coming there. Flossing. Madam Ruth.
Yes.
What is flossing number 1? Na flossing ni ya wazungu ama pia ni ya Wakenya? Na ni watu wanaishi which side of Uhuru Highway?
Yes. Okay, fine. Let me start by saying this. You see, when we do the toothbrush, I always tell my patients that a toothbrush attacks a certain percentage.
Yes.
There's a structure of the tooth that you cannot see. And that's where we come in with the floss, and also we come in with the dental professional cleaning, because we are able to get inside where you cannot reach with your toothbrush. So this is a digital one. We have another one. Apparently we don't have the common one.
There it is. Yeah, right there.
Daktari has it here.
Yeah.
So let me use this probably.
Yeah. But you can also show us how to use this.
Okay.
I got like,
You-
some of this, like
So this one,
this.
this being your teeth,
Yes.
you're able to get inside.
Yeah.
Inside or in between your teeth, and you're able to reach that part that you cannot reach with your toothbrush.
Absolutely.
Most of the time you get, even when you brush and you use a floss, you just feel, it was not that fresh.
Yes.
Because you could not reach that part
Absolutely.
inside. Yeah.
So wait, so how do you use that one?
This one.
Yeah.
So this one is so simple. It's like a digital one of it. So you just hold it like this and get
And can you
inside.
use the same one on the teeth, or you have to keep changing it?
No, you use it.
Oh, you use it all around?
All around. One use, then you throw.
I was like-
One use, then you throw.
Next.
Another one next.
That's
No,
me.
it's one use, then
Okay.
you throw.
Okay.
Yeah.
Okay, cool.
Yeah.
One use all around your teeth.
Yes.
Okay, got it.
Yes.
Hey, anyway, wait.
So-
Can I reuse? Can I go in? Okay, no, I can't.
Too
That's
late.
gross. That's gross.
So this one is a bit manual.
Yeah.
So you cut it like this.
It's not practical to. They say put it in the middle. Like it's easier to use your indexes though.
Yes. So you
Yeah, I
hold it
thought
like
so.
this. Then now you're able to get inside
Yeah.
your teeth,
Yeah.
one by one,
Yeah.
one by one, until you are done. Then
Okay.
the downside the same. Yeah,
Okay.
like this, one by one,
Okay.
one by one, until you are done.
Okay, let me
Yes.
tell you about the Kerry techniques. I tell you whether I've been doing the right thing, because I'm also doing my consultation here. And remember, we're taking all your questions. We paid for your consultation for free
For free.
from both our guests.
Yes.
So like I take like a long one, and then I use like a small part, then I move. A small part, then I move, yeah? I'm a pro. Okay, good stuff.
That's all right.
Daktari,
Uh-huh.
let's talk about mouthwash now. I think she's highlighted everything about.
Yeah, I
Floss.
mean, maybe just an additional
Sure.
on the part of being digital.
Yes.
The current trend is going towards something called a water flosser. Yeah, so there's a water flosser that you can also buy. You use water to actually floss your teeth.
How?
So look it up. I mean, it's just a jet of water that is. So you have a tip and sort of like a motorized gadget.
Yeah.
Like now she has an electric toothbrush.
Yeah.
Now she will now do the brushing with her electric toothbrush, and then pick up her water flosser.
Yeah.
That is also now not those manual index finger or do I toss this? Do I know?
Yeah.
So you just fetch your tap water, point the tip towards your gum, and then it has pulses of water that it jets out, and that is equivalent or even better than doing the flossing, and quicker, and it will actually encourage you to do it on a regular basis.
Fun.
Yeah, so look it up, water flossing.
Okay.
Those are available.
Even as we do that,
Yeah, so
mouthwash. Tell us about mouthwash.
I mean, mouthwashes have various categories. There's the medicinal ones that we recommend for patients after particular surgical procedures or during the gum disease arresting, when we're trying to help them rehabilitate their oral hygiene back to on track. So you can have the medicinal ones that you can get on prescription, and that is advised on prescription for limited use because of the effects they have if you use it for long term. So they will end up being detrimental if you reuse beyond a certain period of time. Then there's your day-to-day, the marketed ones that you see off the market from all these big brands that you can use after your routine brushing. But remember, the best way to clean your teeth is by mechanical action. So the brushing, the flossing that you do, or sometimes you can even use what we call an interdental brush, which goes in between your teeth, so that when you're done with flossing, for those people who have gum disease that has been arrested, and you have those huge spaces in between your teeth that a floss will not necessarily be efficient to use and clean, then you can get something like this. That's an interdental brush.
Wow.
So it's a really tiny brush that you use in between your teeth, and then you can rinse it off, and you have a cup, and this is reusable. You don't toss it away.
Okay.
So you use it maybe for about a few weeks, and then you can finally throw.
Okay.
So you just cup it, and then you store it where you store your brushes.
Can I have one?
Yes, sure.
Oh, sure. Thank you.
Yeah. So, but that has to be on recommendation by a dentist, because sometimes you find, so that mechanical action is what is more important compared to what you would do with your mouthwash, because the mouthwash doesn't really have that targeted removal of dirt from your teeth, but it chemically would stop any further buildup of dirt.
Absolutely.
Right? Yeah.
Absolutely. As we do that, how many times should one change their toothbrush, Madam Ruth?
We should do it 3 times a year or after 3 months. Yes.
Okay.
Yes.
So quarterly.
Yeah, quarterly
Okay.
after 3 months.
How about when you have a homa, you can still keep it?
The best thing is to rinse it after you use. Make sure that you clean it well.
Yeah.
And again, people don't share to your toothbrushes. That's a personal
That's a sign
asset.
of real love. What?
No.
No?
That's a personal asset. So just make sure you change it. You keep it well. We prefer. Maybe I can use Dr. Ree's one.
Sure.
We prefer, like, after you are done, rinse it very well. You can look at some toothbrushes and there's a lot of things inside there.
That's
so just
gross.
make sure it's clean,
Yeah.
and then put it in this angle so that it is well and dry. Yes.
Okay.
Yeah.
Good stuff.
And
So
again,
don't store your toothbrush.
just to add on that, there are different types of toothbrushes, good quality and all that. Okay, if you just look at your toothbrush and you realize some bristles are bending, just change it.
Okay.
Yes,
Okay.
that one is not of good use anymore.
Okay,
Yeah.
absolutely. When we come back, we'll be talking about discolored teeth. We'll be talking about if gingivitis actually leads to periodontitis. Actually, that's a thing. We'll be talking about much more about your dental health. With me in studio is Dr. Elvis Mutai from the Smile Clinic. He's a dental surgeon. Thank you so much for joining us, sir. We appreciate your company. And Madam Ruth Mungai, who's the founder of Smile Changes Foundation and also a dental clinician. This is Health Check on Hope TV, where you look and live. My name is Kerry Kagiri. We'll be right back. See ya.
Thank you.
Yep.
Tangu mwishoni mwa mwaka jana, homa ya virusi vya korona yaani COVID-19 imeibuka kuwa tishio kubwa la kiafya. Maambukizi ya homa hii yameenea ulimwenguni kote, wala hakuna aliye salama. Serikali kupitia idara ya afya imeweka mikakati, miongoni mwao ikiwa uchunguzi wa homa ya korona miongoni mwa wasafiri katika mipaka yake yote kote nchini.
I'm very happy about the screenings that are going on in Tanzania and Kenya. I think it's very proactive that you're thinking about stopping it at the border so that it does not spread.
Inatisha kufikiri kukohoa tu kidogo kwa mazingira haya unaweza sababisha mlipuko wa homa hii usio na kifani. Ili kuzuia haya, serikali imeweka mikakati tosha kuhakikisha usalama wa Kenya wote.
The facility has all the equipments you need from handling a basic patient up to ICU setting.
Hata hivyo, wewe pia unalo jukumu katika kusaidia kuzuia kuenea kwa maambukizi.
Citizen responsibility is the key to the success of this initiative and these measures. Let's all do what we have to do individually. And this is how we are going to defeat this disease.
It's just our general hygiene, okay? And that now means at workplaces, we should ensure that our work surfaces are clean.
Always ensure that nimefanya proper sanitation ya mikono. Every time na board matatu, lazima ni sanitize mikono.
Sisi kama taifa tumepata kukumbana na changamoto nyingi na kali maishani, na kila wakati tumeibuka washindi. Hii homa ya COVID-19 hata kama inatisha, si tofauti nazo. Komesha korona, zingatia maagizo kutoka Wizara ya Afya. Nawa mikono jinsi inavyostahili.
What comes to your mind when you think of the perfect home for your family? Is it the beauty, the comfort, the security, the convenience, or even the affordability? Victory Gardens offers exactly that and much more. It is just 10 minutes drive from Kitengela town and 3.8 kilometers off the tarmac. This gated community project comes with solar street lighting, Maram roads, beautiful trees, 24-hour security, and water connected to every plot. The best part is, families are already living here. Call us today on 0702 831083 or visit www.optivan.co.ke.
Treetop imerudi tena na ina ladha tamu wa kuchangamsha wa ladha ya machungwa, tropical, apple, maembe na strawberry banana. Kaa salama na ufurahie ladha ya kipekee ya Treetop na familia yako. Treetop, you can't beat this taste.
Tunakuletea burudani safi kutoka wanamuziki wa nyimbo za sifa na ibada, mahojiano ya moja kwa moja na mafunzo ya hali ya juu.
Dhamira ya mtu ikifa anaweza fanya anything. Because kile kinanitofautisha na mbuzi ni dhamira.
There was this time niliambia Mungu, mimi samahani Mungu, lakini naona umenifanya mimi kuwa daraja. Sitaki.
Ni mahali pa uchipuzi na ulezi wa vipaji.
Mwimbaji anaweza itisha akitaka, lakini unajua hiyo ni sauti
hajanunua.
Hujanunua, hiyo ni umebarikiwa nayo. So hiyo unaweza mupeane aidha bure ama. Lakini hii pande nyingine sisi tumeinvest, ni investment ona.
Tunabeba mwili, lakini mimi sikujua hii ni maagano nafanya.
Ungana naye Mwalimu Shaban Brima kila Ijumaa saa 2 jioni na marudio kila Jumamosi saa 10 jioni.
Machozi ya furaha nishangaze Baba, kwa ushuhuda wangu watambua wewe ni Mungu.
And we're back. Thank you for staying tuned in to Hope TV, where you look and live. My name is Carrie Kagiri. Today's conversation is on dental health. And some of the statistics we've received according to the World Health Organization is that about 30% of people in the world around the ages of 65 to 74 do not have any of their natural teeth. It's a good conversation to have with your parents or your grandparents, or not. Well, today we do have joining us in studio Madam Ruth Mungai, who is the founder of Smile Changes Foundation. Karibu sana.
Thank you.
And also joining us is Dr. Elvis Mutai, who is a dental surgeon serving at the Smile Studio. Thank you so much for being with us.
Thank you for
When we
having
were
me.
leaving, we were talking about the state of our toothbrushes. We were also talking about how to care for our teeth. And the question, and you had explained this earlier, gingivitis and what's the word?
Periodontitis.
Yeah, that's what I said. Those two, what is their correlation? And just for someone who joined us, can you explain that one more time? And as we wrap up with that, we'll be talking about treating discolored teeth with you, Daktari. Yes.
Okay, we said that a gum disease in its early stages, it is called gingivitis. This is where it attacks now the gum. It's red. It's you're getting sensitivity. You're bleeding, not so much, but you can see those signs.
What is the usual color of the gum? Because maybe someone thinks, men are colorblind. They might be thinking red is pink, pink is red. They have no idea.
Okay, well, I've seen people have different types of gums.
Yes.
There are those which incline to darkish. There are those which incline to pinkish. But you see, when it's red, that typical red, and it's looks like it's bleeding, you can tell that is a sick gum.
Okay.
But now when it advances, it goes to those level of there is pain. When you brush, you can see a lot of blood. Now that is what we call periodontitis.
Okay.
So gingivitis is early stages. Periodontitis is an advanced
So
gum
gingivitis
disease.
can lead to periodontitis.
It is a progression.
It's a progression.
Yeah,
Okay,
yeah,
absolutely.
yeah.
So you need to take care of that. If you see that, go ahead, see your dentist, see our people right here. You have a clinic in Kawendani. But I was in KU on that same note. I forgot to tell you.
Oh, fine.
Yeah.
Now you'd be there and I've seen you in Ghanaite.
I'll come. I'll just run. And go ahead
But,
and see our doctor at Yaya Center on 3rd floor. That's at the Smile Studio. As we talk about that, discolored teeth. How can we treat discolored teeth?
First of all, we need to understand the stain.
Yes.
What has caused the discoloration? As I said earlier when we were tackling gum disease, that sometimes the initial stages of gum disease will appear as stained teeth. Your teeth no longer have that shine they used to have before. So for that, it's a simple, straightforward procedure. Come in, go clean, you leave with better, brighter teeth that you used to have before. The next stage is what we call intrinsic stains that are now in the tooth, and I mentioned it now with this rise in borehole water use because people want to rely on themselves because council water sometimes has the cartels that we know about.
Thanks for saying it.
Yeah, so we have people now deciding to dig their own boreholes, and it's an attractive package to have in an apartment that you're going to live in or buy. So you find the borehole water now has a lot of fluorosis because of the area we're in, and then that fluorosis will have a lot of fluoride in it, and then that will manifest as fluorosis on your teeth. That's browning. They sometimes become milky white or too white, bright white, and then that bright white is basically porous enamel that we mentioned. That is the white surface of your teeth, the hard part that bacteria will attack, now becomes porous and picks up any stain that you have in your food color. And then with that, now we will have to tackle it a different way. So now those intrinsic stains come about in many ways. So you can find the kids whose mothers use tetracycline, antibiotic during pregnancy. That gets taken up in the blood system, as you said, goes through the placenta, goes into the forming teeth of the child, and then that manifests as dark blue stains on the teeth. There are those ones who will develop it because of the fluorosis I mentioned. There are others who will develop it because of other diseases that are out there, blood diseases that tend to leak into the enamel when they're forming. So with those ones now, we will treat it differently. And there, even in adults, you will find you have perfectly white teeth. You hit yourself against something, and then after some time, it starts to darken.
Yeah.
So those ones now again treated differently. So if it was white before, you hit yourself, and then that tooth becomes painful for a bit, or even loose, stabilizes, and then you think, nothing of it. And then after some time, it starts becoming yellow or a dark color. All right. So you need to come in. We do a root canal. After a root canal, we'll bleach the tooth. It will come back to the usual color.
Okay.
Then there are others who just have naturally creamy teeth because the enamel is just a bit too translucent. So the dentine shines through. So for those ones, we can do bleaching. Others we can do, if it's very minor fluorosis, whereby the water, the consumption was not that much, or they shifted. So they started here and then drinking borehole water, then went to a place where they were getting council water that is filtered and less of fluoride. Then you find that now we can do what we call masking. We just cover them up, those small stains. And then at an advanced stage, we can do what we call veneers. Basically what you do is that you reduce the tooth or the stained part of the tooth, and then you cover it up with something that is made out of porcelain, like your teacup, but now dental specific porcelain. Yeah, that's basically like the stages you can go through.
Okay, our call line is open and the numbers are on the screen. Go ahead and give us a call. We'll be answering all your questions. But on the text line, so many questions coming in. Can we start answering them? Then we can continue with our questions. Kindly advise. I have sensitivity on my teeth on taking either cold or hot fluids. That's the first question. Who wants to tackle it?
Okay. So this sensitivity, it's can be two issues. It can be the gum issue, and it can be the tooth issue. So the best thing is to see a dentist. Then we'll be able to identify, give you a good checkup, and we'll be able to identify. If this sensitivity is coming from the tooth, this is where you are done a filling. If it's coming from the gum, this is where you're done the cleaning, and the sensitivity will go away. We also advise what you can use also to ease the sensitivity.
Absolutely. One asking a very interesting question here. Alex, our ancestors never had modern toothbrushes or fluoride toothpaste. Did they have cavities, or how did they manage this?
That's an interesting question, and he's actually right in that sense, because the ancestors, what they would do is the structure of their teeth was not suffering more from tooth decay. And even right now, when we go to areas where they eat less refined food, they're not really tackling cavities. So tooth decay is a very modern disease. The one they would suffer more from would be gum disease. And from different cultures back in the day, like the Islamic culture, they used to have what they call muswaki. The muswaki would be something they would do during the preparation for prayers, because they have to go in clean. So they would do it 5 times a day. So the gum health among that community would be better than those ones who have no interest in it at all.
Absolutely.
So they would suffer more from gum disease than they would suffer from elements of tooth decay.
Absolutely. Okay, someone's asking how... sure.
I can also add something.
Sure.
That you remember the old people, they had this habit. When you are going somewhere, you had to pick a stick. Yes, and they used a lot of that. So most of the time, they didn't have those particles in the food. But us, you brush in the morning, then you brush it at the night. So in the day, you're snacking, you're taking carbohydrates, you're taking sugary things. So at the end of the day, your teeth get decayed.
Absolutely. I think I've been with the Maasai community. They have something, and it's called the Mugogoi sick or something. So you just keep, and you rub each tooth. So really, they have a better chance. Someone is asking, how often should we floss?
After every toothbrush you do.
Okay, so you can floss daily?
Yes.
Okay, cool. Loving the show. Is it okay to use salt for brushing your teeth?
The mechanical action is what really counts in this sense.
Okay.
So if you're, some people are not comfortable with certain kinds of toothpaste because of the taste and whatnot. So if you have warm salty water and salt, and then you mix it, but you have the mechanical action of brushing, that is super.
Okay.
There's an additional benefit of the toothpaste because it has a soapy element that will help you clean, and the fluoride element. But now you see, we have a lot of fluoride in this part of the world, as opposed to the West, where they cleared out the fluoride from the water.
Okay.
So they encourage now the fluoridated toothpaste there. On this part of the world, there's just too much of it because you're using a lot of ground and purified water.
Absolutely.
Yeah.
Okay.
That's
Okay, Gideon in Raqqa, good evening. Thank you for calling. Gideon.
Yes.
Good evening. How are you?
I'm fine.
Karibu sana Health Check. What's your question, sir?
Okay, niko na swali.
Yes, uliza.
Niko na there is an hole in my tooth,
Mm.
and I knew me, but is it, I'm asking a dentist, is it advisable to remove or to fill it?
Okay. Doctor, did you get that?
Yeah.
Okay, sure. We'll be answering you. Thank you for watching Health Check. Okay, our call line is open and we're answering this question. He has a hole in his tooth. It's not Ayumi yet. Can we add yet?
We can add yet to that.
Uh-huh.
So he doesn't have pain, but that hole is now packing food in the mouth.
Oh, no.
And that is bacteria, and that is an area of possible infection and reduced gum health in that particular area.
Mhm.
So with time, you can go pain-free until the tooth is reduced to a root. But then why do you want to get to that stage?
No.
Save the tooth in advance. The sooner you see your dentist, the cheaper it is, and the easier it is for us to restore the tooth with longevity.
Mhm.
So if you had to look at that tooth now, you want to keep it now. If Gideon's sake, he sounds like a young man.
Yeah.
If he has another maybe so many years to
Mhm.
go, and if we save the tooth by just putting a filling, that tooth can last 20 plus. If we do a root canal, that reduces that 20 plus to significantly less. If we do a root canal and a crown, that is even less. If we get to a certain stage where we're like, we're not so sure if it will survive, but let's just try, then we're reducing it to a less than 2-3 year kind of a situation.
Yeah.
And you don't want to have to replace natural teeth.
Mhm.
That is the worst thing because nothing can ever replace your natural teeth.
yeah.
So fill it up. I mean, you need to use it in the mouth. You
Yeah.
need those teeth in the mouth.
Okay.
Right.
Okay, so the advice is to fill it up, get to see the doctor, depending on which side you are. Umesema he's in Roka.
Yeah, Roka.
Roka, I think he can get to Baraka Smiles. Do you fill up teeth?
Yes, we do.
Oh, okay, good stuff. Okay. Even as we get to that question, ati big ups to Madam Ruth. You're doing a great work. That's Anne Murimi. Yes. Unaweza tuma salamu pia. Our call line is definitely open for you to ask all the questions. When should children begin brushing their teeth? But before you answer that, can I pick a call? But you answer that right now. Liz in Siokimau, good evening.
Hi.
Hi, thank you for calling, Liz.
Okay.
Go ahead with your question.
Oh, my question is,
Uh-huh.
my son had some cavities on his tooth,
Uh-huh.
and we plucked them out.
Uh-huh.
I took him to the dentist, and they were plucked out. Is it plucked out or they were just removed? The front teeth, 2 of them.
Uh-huh.
And now, that was, I think, 2.5 years ago. And now he's 7, and the teeth, his tooth have never grown back, his teeth, sorry. So should I be worried? What could be the problem?
Okay, thank you, Liz. We'll be responding to that. Do you have any question for her? Okay, thank you. That's fine.
That's the only question.
Thank you so much. Okay, wow. Yeah, Doctor, can you respond to Liz as you get to responding to when children should start brushing?
Yeah, so the removal of teeth that happened 2.5 years ago, as you said, and now the son being 7, is not yet a time to worry.
Okay.
Those teeth are possibly just going to come through. For boys, we tend to see the earliest we see those front teeth when they're removed. The earliest we see the front teeth when they're removed is 5 years, mostly in ladies or maybe the girls. And then for the boys, they can even delay all the way until 9 years of age.
Okay.
So it's not a point of worry yet. However, at the age of 7, in the field of orthodontics, that's braces and whatnot, we like to see kids to manage the growth because sometimes you find they develop habits in between that will hamper the normal growth of their jaws, that will enable them have all the 32 teeth come through without any complications, particularly the canines. So my advice to her is that see a dentist. There's an x-ray that we do, and that can actually reassure you that those teeth are in the jaw and they're going to come through sooner rather than later. Yeah, so that is the best age for us to assess kids in terms of their growth.
Okay.
So that's a good question, and I'd advise see a dentist, have that x-ray done, and then we'll see the teeth in the jaw just coming through.
Yeah.
Or if not already. Yeah.
Awesome.
Yeah.
Doctor, Madam Ruth, as you're answering, can I pick Charles? And then
Yes.
we're coming to you. Keep the
Okay, no
question.
problem.
Charles in Naivasha, is it? Charles, good evening.
Good evening.
Thank
How are you?
I'm fine, thank you. Thank you so much for watching Health Check. What's your question?
First is to greet Madam Ruth, and I had a question. Over time I had a pain on my upper jaw side, and it was really sore. And I really wanted to know how can you control that kind of pain that occurs frequently, then it disappears on its own, and what causes such pain?
Okay, do you have a follow-up question?
What kind of pain do you experience exactly? Is it sharp pain or?
Like it's having some sore, like on the upper jaw, in between the tongue and the teeth.
In between the tongue and teeth?
Yes.
And you're saying that it's a sharp pain?
Yes, and then it comes on and off, then after a few times to recur, and I was wondering what can be the cause of such.
Okay. Okay, Charles.
Yeah.
Thank you. We'll be responding to that. Before we respond to him, can we go to the question on what age children should start brushing? Yeah.
Okay, fine. What we can say, as soon as the first tooth starts setting in, you may not use a toothbrush, but you can take a cotton wool, a clean cotton wool with some water, and you can wipe out the teeth. But as the child grows maybe to 1 year, I've seen nowadays there are some specialized toothbrush for pedo children, for little young children, so you can use them to brush those teeth. But as soon as you start seeing the teeth sets in the mouth, start brushing them.
Okay.
Yeah.
Okay, thank you for that. Dr. What's your response to our caller, Charles?
Charles, the pain he's complaining about, and then, I mean, from my understanding, between the tongue and the teeth, and it's on the top jaw, that would probably be on the roof of the mouth, if I'm getting it correctly. And then, again, this can boil down to many things. If we can talk about the easier one to be managed, you're probably talking about early onset of gum disease that can be very aggressive from time to time, and those aggressive kind of gum disease will tend to attack the front two teeth and the first molars on the top jaw, and that can advance so fast, and then you find those teeth are appearing longer than normal, and thereafter you find that you might end up losing those teeth or requiring replacement for them. However, that is just a simplified kind of guess for what it is that he might be suffering. I would advise he sees a dentist as soon as possible, not to nurse the pain. Okay, because again, it's always cheaper if you come in immediately you realize or feel like you have something that is off the normal curve, right? Because it could have been going on quietly in the background, and now it's starting to manifest at the aggressive stage. So see as soon as possible a dentist. In Naivasha, there are many dentists, or in Nakuru, if you can make it there, even more, and have that sorted out as quickly as possible.
Okay, absolutely. Okay, cool. Another phone call. Let's go to our call line. Thank you for calling Health Check. Hello, good evening.
Fine.
How are you? Fine.
Okay.
Yes, go ahead. What's your name and what's your question?
My name is Wilson Bae.
Yes.
Yeah, I've come across this kind of debate on the TV, yeah?
Yes, thank you for watching.
And I found it well that I talked to you so that I can get enlightened more.
Yes.
Now, you have said about the fluoride, eh?
Yes.
Well, that actually affects the teeth. And much is gotten from the boreholes, eh?
Yes.
That have been sunk. If you do, as per the research around, you find that most of the people nowadays are using those borehole waters, eh? And those borehole waters are having that kind of an effect.
Yes.
Even the government herself, it is sinking boreholes, eh?
Yes.
I've never seen the government emphasizing on how to address that issue of fluoride in water. So I find it being very dangerous to the population of this country, or the citizens of this country.
Yes.
And now, how do we address the issue of fluoride in waters? That is borehole waters. Because even government is teaching those borehole waters, and that they have never even tried to address the fluoride in those waters. Now it means that we are sitting on a table.
That's true.
Yeah, so the government will wake up and actually address that kind of an happening, because you continue consuming that kind of water, and then it is going, in fact, to affect a number of people in this country.
That's true, Wilson.
So when the government herself is thinking boreholes, they should also do make an effort of addressing that presence of fluoride.
Absolutely. Thank you so much for
So
that.
what I can say is, please
Yes.
sell the idea to the government and put an emphasis to
Yes.
that.
Yes, absolutely.
So because prevention is better than cure.
Kabisa. Asante sana. We do have organizations like Small Changes Foundation that can take this up and have even more of a conversation about it. What do we do about it? Do we buy a special bottle in your brush meno? Or what do we do?
Maybe the good news I can tell our viewer
Yes.
and the rest is this fluoride, or it affects mostly when someone or a child takes it when the teeth are developing. If today I go to Nakuru or Naivasha, where there's much of fluoride, my teeth may not get affected. Like me, I did my studies, my high school in Nakuru, and you can see my teeth were not affected. It affects mostly when a child teeth are developing. So what we advise most is, if you have a young child and you're doing a borehole water, don't use it for the child. Maybe you can do a dispenser, or you can buy water for that child to use for their food, for drinking, and even to brush. Until now, their teeth develops fully.
So the formative stages.
Yes.
Okay.
Yes.
Maybe you can add on.
Yeah, just to add on to that is that yes, she's very right in terms of, and don't forget cooking as well, because they're consuming the water, and if the mother is pregnant, there's some teeth that form in the womb, so the mother during pregnancy should avoid the same water. Another additional good news that we might have, there's a church group in Nakuru, I think it's the ACK Church. They developed a filter. So if you cannot afford that consistent buying of water, you can buy that filter and you filter the water that will remove the fluoride in there, or you can even visit the water pump vendors. They tend to have those filters that are specific to fluoride.
Wow, that's very interesting. And maybe we can take this up as we continue. Our call line is open for you to ask all the questions. Maybe we'll pick 2 more calls. Harry Namus is saying he's watching with dad and the girls. Hey, uko na mafans? Hey, my friend.
That's my pastor.
That's your pastor?
Yeah.
Awesome.
I send greetings.
Okay, so even as we continue, we did keep this, and receding gum. We have to highlight this. What is receding gum and how does that look like? Maybe we can start with you, Daktari.
Basically, if you look at the model here that I brought for demonstration, you find that is how normal gum should appear. All right. So over time, when you ignore gum disease, then the same tooth will start to appear slightly longer than normal. So you find that now when it starts to appear longer than normal, it's not that the rest of the teeth have shortened. No, it's just that the gum that is covering it, like it should right now, has gone below the level it was initially. So that tooth will start to appear longer than it should be. And that is what receding gums is. So now the exposed part of the root is now that will cause you to have the sensitivity, because that is not as hard an enamel, it's not as hard as enamel, and it will now be very close to where your nerves are, and that sensitivity will happen. Also, it is softer. So when you brush your teeth, they'll tend to wear out faster than they would, than enamel would.
Okay, Dr. I'll let you continue with that just after this call. Kelvin in Muranga. Good evening, Kelvin.
Okay, I'm from Muranga. Okay.
Yes.
Is it possible for you to put implants? So it is advisable to put an implant in your teeth. Another question.
Yes.
Is it possible to whiten your teeth if they're already brown and affected by water? Can you whiten them?
Sorry?
Whiten your teeth when they're affected by water?
Yeah, you glue up and they became somehow brownish, but you want not to whiten them.
Okay.
Can you go to a dentist for them to be washed and become white again?
Absolutely, yes. Yeah, Dr.
Yeah, it is very advisable.
Awesome, we will respond to that. Thank you.
An implant?
All right.
We'll answer you, yes. Thank you for the question. Okay, yes, let's talk about implants. And what are implants in the teeth?
Okay, so there's a model here that I came with as well that has that demonstration of an implant. So when you have, maybe the camera can show,
Yes,
I mean, if you can get close to that area there. So when you have a missing tooth, you have two options of how to replace the missing tooth. For example, if we shift over to this other side, you can have the two adjacent teeth. Let me just remove this. So you can have the two adjacent teeth reduced in size, and then you fabricate something like that. That's called a dental bridge. Okay, that we will then come and use, because now you see the middle one is a missing tooth. The ones on the side are the ones that are going to support that middle tooth. So the
Okay.
two teeth will act as a pillar to support the middle one. That used to be the common practice from back in the day.
Yeah.
But then you see you're reducing two very sound teeth to support one missing tooth. Should anything develop of the two teeth, then you're suffering three,
Yeah.
because there's a missing one and the two that you have reduced in size. Now, the other option that you have is to have a dental implant, which is basically like a metallic element that we insert in your gum, into your bone. It is not as painful as it looks. In fact, it is even better an experience compared to an extraction. And then once it sits in, it has a root sort of appearance. So that will act as a root of the tooth, right? Unlike this other one that didn't have a root. So that will enter the gum, and that will be the root of the tooth. And then we make the crown, which is that top part, that we will come and put on top of that implant, and that you can use to chew.
Okay.
So the two adjacent teeth are very sound. They didn't have any problem,
Yeah.
and they're uninterfered
Wait,
with.
I like that
Yeah.
implant conversation. We're coming back to that. Florence in Kikuyu. Florence, good evening.
Hi, good evening.
Yes,
I would
thank
like
you
to
for calling.
ask- I would like to ask the question about the partial dentures.
Yes.
If the doctors, they can put the dentures, two dentures or double, will you please help me?
Do you want to have dentures on, or?
Yeah, I've got two teeth
Yeah.
which are broken,
Yeah.
the next to the scissors ones.
Broken or missing?
They're missing two of
Okay.
them.
Two at the
And-
front.
Yes.
Okay.
And I would like to know if you do the dentures.
Yes, we do. How old are you now?
I'm going 42.
42. Okay.
Mm.
How long ago did you lose the two teeth?
This year, actually, from January.
In January. Okay.
Mm.
All right. So,
Okay, we'll be responding to you, Florence. Thank you for watching.
All right, thank you.
Yeah, keep watching, keep watching, keep watching. As you answer these questions, maybe you can pick up another call and wrap up the call section, because the show is 12 minutes to go. Time flies when you're having a good time. And thank you for everyone who's just watching us and telling us they're watching. Gloria is watching, just saying hello. Thank you for the good work you're doing. God bless you. Amen. We receive the blessings. God bless you too. And all of you. Arnold Omuhulu is watching from Kericho. Who is that?
It's my church mate.
Hey, Ruth and our fans. Daktari, what is it? Is well. 2093. Oh,
Okay.
sorry. 22232 is our text line. I will continue with your texts, and yeah, let's do that. Can we respond to those calls?
Yeah.
Yeah, sure.
Okay, first I can respond this for the whitening.
Yes.
The Moranga.
Yes, Kelvin.
Yeah, so Daktari has answered the implant, so I can respond to the whitening. Yeah, it's possible to do the whitening. I think Daktari had said it earlier. We can do what we call masking. That part of the discolored tooth is removed, and then you cover it with material which is white in color. Then we can also do veneers. Yeah, those are like covers that cover that tooth. And also you can do a full one, the crown, which he said they are called porcelains.
None of these things will come out when you're eating one day. You're like,
No,
my veneer.
they are cemented. They are
Oh,
very
okay.
cemented. Actually, we call them permanent
Okay.
restoration.
Okay,
When you do them, you cannot remove them. Yeah.
Awesome. And
yeah, so to answer Florence from Kikuyu about the partial dentures, yes, we can do dentures. That's an option of replacing teeth. You will wear them in the morning, remove them in the evening as you're going to bed, clean them up, put them in a cup of water that is room temperature, and then repeat the routine every day. However, if you have these teeth that you've lost in January, what we look at in terms, and then the age that she's at 42 years of age, we're thinking she has another 40 or so years to go in life.
Yeah.
And you need something that is of comfort. The area she's lost the teeth is the front, which is the aesthetic area, and that has a lot to do with lip support. So we want her to sustain that the aesthetic appearance throughout the duration of her life, and for her to have a pleasing smile. And then because of that, now we will now lean more towards a fixed solution, because a denture is a removable thing you remove in the evening, and then that denture has an effect of causing bone wear because it is purely bone supported. So you find that my advice for her is to consider a fixed option to avoid that bone from shrinking over time, because once you remove a tooth, that bone that was supporting the tooth underneath was going to shrink because there's nothing to cause it to remain as bulky. So now I'd push her towards the direction of an implant, so that now that bone fullness and lip fullness is sustained throughout her remaining life. So yes, you can get a denture. It's an option of treatment. It's the cheapest available option of tooth replacement, particularly, you know, if you want a quick fix and, you know, you've lost your teeth like in January, and maybe you're trying to organize your finances before you get the implant. Yes, you can do a denture, and we do them.
But just one more time with the implant. So how does the crown sit on the implant? Like, how does it now stay attached? Because you said there's a root is what you put the metallic.
Yeah, so that goes into the bone. The implant goes into the bone.
Yeah.
And then there's a part sticking out. There's a part there that is sticking out, and that will act as a support bit for the crown that we put in.
Yeah.
So we have the cement that she mentioned.
Yeah, I see it now.
Yeah. So there's a cement that we mentioned, and we put it into that hole there in the crown. Okay. So that will hold the cement, and then once we have the cement, it will hold it against the on that implant in the bone. That design that we have made of this crown is such that even without the cement, there's an element of retention, so that it will hold even without the cement. The cement just improves the adhesive element of it, and the others that we actually just screw onto the implant.
Yeah, absolutely. Let's continue with the questions as we wrap this up. And I think an important thing when you're dating someone, please ask them, are those your teeth? Even though you bought them, please tell me, because it's going to be a situation. But let's not go there. Yeah, please. One is asking, Daktari, I was extracted a molar tooth and I keep getting an infection and pass. What is that? Shiko in Meru. As you answer that, Daktari, Madam Ruth, you'll answer this one. My son who is 6 years old has a cavity. Is it necessary to fill or wait for the tooth to come out? Ooh, I have an answer for that, but I'm not the doctor.
For the pass from the extracted tooth, see your dentist, and then that should be addressed as soon as possible.
Yes.
That's an active infection. It would come from the adjacent tooth that are left in the mouth, or maybe partially from where, if it's a fresh extraction, possibly that area that was extracted from is infected, and that needs to be treated as well.
Tafadhali.
Yeah, so please see your dentist as soon as possible.
Shiko, keep your smile. See your dentist as soon as possible. And for the 6-year-old son?
For the 6-year-old son, I wish she told us they are the anterior teeth or the posterior teeth.
Yeah.
If they are the anterior, they will get out soon.
What are anterior and posterior, just for people who don't know? Me, I know.
The anterior, they are these front teeth.
Okay.
The posterior, they are these teeth behind.
Yeah, we knew that.
Yeah. So if they are the anterior, they will be coming out anytime soon from 6 years.
Yeah.
But if they are the posteriors, those ones will come out later at age. So they need to see a dentist and they need to be filled up. Yeah, because let me just explain something. These teeth for the milk teeth, they have a function in the mouth. They retain the space. If you remove them earlier, your jaw may not even grow well as it should be.
Is that the bone you're talking about?
Yeah. And number two, the space that is there also can harbor bacteria and it can lead to more infections.
Okay.
Yeah.
We need to wrap this up. It's been really good. I mean, we can't finish everything in one sitting. let's talk about general keeping our teeth healthy as you give your closing remarks. We end this in about 6 minutes, so we can start with ladies first. Yes.
Thank you so much. I think for me, it's a real passion just to do a healthy smile. I call it healthy smile advocacy, to help people realize and know that they can do something about their teeth and their oral health. And actually, most, almost all of the issues in the mouth, they are preventable. If you do the right things like brushing, having the dental checkup once, let's say twice a year, and you get good advice. When you come to the dentist, we are able to see the problems that you have, and we are able to attack them. So it's very good to have those checkups. Just make sure once, just invest in that 1 year checkup or twice as the dentist would advise, and you will never have issues. So it's very important, without teeth, you cannot talk, Kerry. You lack confidence because those are the functions of teeth. So I always say teeth is very small, but it's a God-given gift. So take care of it. Like the way we do to our hair, let's take care of our teeth. Let's invest in our teeth, and you will have a good future. And something else, just as I wind up, most of the people in Africa, in our Kenya, we know and we say dawa ya meno ni kung'oa. You wait until the problem has progressed and there is nothing much we can do. And when you're coming to us, it's irreversible. So it is good to know that you can prevent, because if you get to that point and you've extracted and you've not restored or replaced your teeth, there are consequences. You get that person grows older. You are 45, but you look 70. Because without your teeth, the supporting structure tends to fall. Number 2, if you have that gap after you removed the tooth, because how God has created the teeth, they have partners. The upper one has a partner to the lower. So if we remove the lower one, it will tend to look for the upper one, and it will tend to be longer. If it's longer, you will end up removing it. And also the other ones, they will tend to look for that partner, so they drift a bit. After they drift a bit, they also form decays inside there. So you cannot do good hygiene, and you end up losing all your teeth, and you grow older. So keep healthy, have a healthy smile. My slogan is healthy smile.
Healthy smile.
Healthy future.
Thank you so much. Please check her out and follow her foundation.
Smile Changers Foundation.
Yes, absolutely.
Baraka Smiles.
Yes, awesome. You're such a plug. For you, Dr. What's your closing remark?
My closing remark is, I like to see kids from as early as when they have teeth in the mouth, and I'd like to educate mothers, because there are certain habits that you can encourage in mothers, like breastfeeding of children, for example. It starts that young. If you breastfeed for 2 years, that child will have a very good jaw formation because you've cultured the muscles. So that is where you start. You don't start when the teeth are in the mouth. You start by forming the muscles around the mouth that will now enable the jaw to develop normally, and then have those jaws allow teeth to come into that space. That's the beginning of good oral hygiene, or health for that matter. And then you progress to maintain them throughout when they are milk teeth. Do not disregard milk teeth, as you said. They play a role in maintaining the space that for the incoming permanent teeth. And then that regular visit to the dentist and culturing that regular visit to the dentist will keep your dental costs on the lower side and will keep your oral hygiene on the top, so that you will find that anything that we see early stages is easier to manage and arrest, give you a better experience, reduce the needle use for you, and we will also pick up bad habits that we can encourage you to stop because we were getting it at that early stage. And then just sustain the same way she said, your teeth are a priority and the health of those teeth are a priority. The same way you want to look good, the same way you want to drive a good car, the same way you want to have a good living neighborhood, is the same way you should regard your teeth, with that same kind of priority. But people will buy a good phone, people will buy a good tablet, they'll spend 40, 50K, a dentist say a consultation is 3,000, they're like, oh, too expensive. So the same way, prioritize. That is your look. And trust me, what you said is true. You lose your teeth, you lose your age, or rather you gain age almost significantly.
Oh my.
So.
Well, thank you so much. Thank you so much for your company. I wish you well even as you pursue this season. And just asking the doctor's price for tooth replacement at the place of work. Well, you can go visit Daktari. He's at Yaya Center, 3rd floor. It's called the Smile Studio. So, end up. Yeah, he'll tell you the prices there. Even as we do that, let's wrap this one up. And thank you so much for watching. Take care of your teeth. It's a huge part of even your general overall health. They do play a huge role. Remember to share this video. Remember to tell everyone to watch and get all the information that we've shared today on Health Check. Remember also to share. And also visit Baraka Smiles. I might be going on this glass up. Visit Baraka Smiles Dental Clinic as well. If you're around that side of Thika Road. What Thika Road is. So we have both sides of Uhuru Highway in the studio. So you can go ahead and do that. Thank you for watching. This has been Health Check with me, Carrie Kagiri. I'll see you tomorrow at 5 a.m. on Hope FM, where you listen and live for Activate. Tonane. Good night. Bye. Thank you.